Good evening. I am Dr. Bill Pavelitz, clinical educator for VOCO America. And for the next 50 minutes, I have the pleasure of speaking on a subject that is very close to me. It's the small details making big impacts on dentistry. And what that title entails is Nano, ORMOCER, thermal viscous technology, or TVT, and their impact or the advancements in composites and bonding. So we're going to get started. Who am I? I am a graduate of Temple Dental School back in 1991. Decided to enrich my dental career and go back to my alma mater of University of Pittsburgh, where I did an AGD residency. And it was during that residency that I took a liking to prosthetics, and I applied and entered into the prosthetic program at University of Pittsburgh. Unfortunately, life throws you curveballs, and my dentistry career was at a halt due to an injury to my right arm, but I made the best out of it. And I took those years of education from Temple, from University of Pittsburgh, and I applied it to a great company, VOCO America. And I do have to thank them this evening, along with Viva Learning. VOCO is sponsoring tonight's CE credit. But that said, this is not going to be an infomercial on VOCO. I do have the privilege of speaking to dental professionals, dental dealers, depots, universities in regards to certain topics. And, tonight's topic is something that we can probably spend a whole day talking about, whether it be the Nano or the ORMOCER, or even the thermal viscous technology. But for the next 50 minutes, I'm going to highlight some of the nuances to these products. And I'm using the lecture for the audience. We had over 930 people registered. And I want to thank everybody for taking their time this evening. But open up a dialogue, kind of make you think about what products you are using. Are you working for them, or are they working for you? And the characteristics I'm going to be talking about this evening in regards to this technology will make a dental professional, whether you're an expanded function hygienist, a dentist, take a look at the materials that you are using, and are they giving you the end result? Because we look at our work out there all the time on recalls, and we see the wear and tear that our patients put in the oral environment that they're dealing with. And sometimes the materials hold up, sometimes they don't. So we're going to get started with the lecture. And I have to ask, this is probably very childish, college prank on my end, but ask the audience, does size matter? And you're probably wondering, hey, Dr. Bill, what kind of lecture are we getting into? And it is something that makes one thing, a dental professional, why would we deal with size? And again, if you're a hygienist, a dentist, expanded function, you're looking at the dental materials that you're using daily. And size does matter in the chemistry of these dental materials, as the materials will work for us. Light curing, we're going to talk about desensitizing. We'll talk about even tooth creams, how all of this science is making an impact. Now, back in 1991, when I was a dental student and starting off my career, we learned about many of these materials. And why do I bring it up now? And we see from looking at journals, magazines, speaking with dental representatives that come into your office, we've seen an evolution where the past has taught us the makeup of certain materials gave the clinician characteristics that some of us desired. Others, we had to deal with some issues. And it was either with micro for the great aesthetics and poor wear, the macro materials that entered into the marketplace in the late 70s, giving a reverse, great wear, but poor aesthetics with our end result composite veneer. Then the hybrids came along, and we started to see a balance between the characteristics of the wear and aesthetics. And as always, manufacturers will come up with new chemistries as they evolved with the micros or I should say the micro hybrids, to improve the aesthetics. And, as a seasoned professional, you may still be using one of these older chemistries. And don't get me wrong, there's nothing wrong with that. A lot of times the chemistry works in the clinician's hands. They know how to adapt with the materials, whether it be the composite being too stiff or sticky. Clinician, he or she, may have the ability to use a bonding agent on the end of their condenser and have the material release from that restoration without doing any harm or damage to the aesthetics or the final restoration. Fast forward, like anything, we see now the new sciences entering into these materials. And what we see is the future of nanotechnology. Nanotechnology actually using as a pure technology. You may see a hybrid version of it, combining with some of the other technologies that I spoke about earlier. And we have to see, why is nano really the future of dentistry? Because we look at its existence in our everyday life. We are all walking around with some type of manufacturer's phone, an Apple or a Samsung. That screen, that glass has a protective coating on it. For women and some men, you look at nanotechnology in our everyday life of hygiene with makeup, foundation, moisturizer, sunscreen. And so much so, we see it within the medical community, where they're looking at advancements in treating cancer and different diseases. Why? It's because we're able to manipulate or formulate a particle within this material that in the past would have a bigger impact, may be damaging to the surrounding healthy tissues. Now we're looking at it in the sense that, what can we do with a nanoparticulate in dentistry? And it's interesting when we see that the characteristics that, you're a restorative dentist, an endodontist, orthodontic, even a hygienist, we look at the preventative and the restorative materials that are at hand. And many times when we're talking about characteristics, we definitely want low shrinkage. We want the material to stay in place, not have a lot of shrinkage where it's putting undue stress on the tooth. So it actually lowers the stress within a restoration. We want a material that can last longer. And we equate that with a material that has very low wear. That low wear, long lasting, that gives the end result to our patients a restoration that is longer than most of the other materials in the past that we dealt with in regards to their longevity. For a dentist, I think we demand shade stability, the ability not to pick up outside materials like coffee, red wine, things that have the ability to stain these great restorations that we do, whether it be veneers or even posterior restorations. That ability to have something that's stain resistant is a desire that many of us are looking for. I mentioned sticky composites. We've learned to adapt with that ability to dip that condenser in that bonding agent, as I said. Well, what about having a material that is actually packable and not pulling away from the restoration or getting stuck on that instrument? Again, things that we're looking for. Radiopacity, the radiopaque of the restorations we're putting in. We've seen other manufacturers add materials to their composites to give them a higher radio opaqueness. And it's great for visibility, but we're also looking at what is being added to these composites. Are they good for our patients? Is there a biocompatibility to these materials? And many of the technologies that I mentioned earlier is changing all of that. It's giving them a more bio-friendly or biocompatible alternative when it comes to dental materials. So, I'm throwing out all of this technology. We have to start from the beginning. What is this nano hybrid technology that's making a big impact with our profession? And you take a look at what nano hybrid technology is. It's actually the ability to manufacture a nanoparticulate, small round balls of glass. They vary in size, and actually we're seeing the advancement that we're able to get more of it into the composite because they're able to make smaller particles, that 20 to 60 nanometers. And when you think about it, they're so small, it seems like they flow like a liquid, even though we're dealing with a composite. We look at the matrix or the makeup of these materials, whether it be preventative, and really preventative is the starting point where these technologies are being introduced to certain desensitizers and tooth creams, but it's with the restorative material that allows for a reduction of the amount of resin being made up within this matrix. And we're also looking at reducing or even eliminating or getting close to eliminating 100% of some of these traditional monomers that, as we remember from dental materials class back, in school, that certain monomers are useful and needed in regards to a material like a composite, like a bonding agent, for it to go from a soft or liquid state, be cured, to a solid mass, hardened. And for us, why would we want something like that? And it is the ability to reduce the amount of resin and increase the glass fillers that, as a clinician, I would actually long for a lot of these physical properties. Again, I mentioned improving the performance and longevity of the composite. Better aesthetics. We're able to give the teeth a more lifelike appearance, even though we're using a Vita shade guide and we're blending it to the natural tooth structure. But it's beyond some people's comprehension when you think about how they look so much like a live tooth. And when it comes down to its easier handling, I think we have to try not to make certain sacrifices, but if the material works better in our hands and we're able to sculpt it and contoured in a certain manner that's much easier than getting out, a new quarter diamond or a burr to reduce. We're actually allowing the material to work for us and not the opposite way. So these hybrid composites are still evolving. I mentioned earlier where you're looking at these materials that we're able to get more nanoparticulate in it. And it's the chemistry. There are other companies that have been doing nanotechnology. Voco has been one of the leaders in regards to their composite matrix and the technology that they're putting out there and improving on. Interesting enough, they're actually improving on the size, reducing the size using new micro filler systems to improve that, or even looking at the initiators and the inhibiting systems that have a higher resistance to ambient light. And we've all been there. We've dealt with the bracket table, our assistant, we're working with a composite, and we know that it's very light sensitive. We have to pull up our overhead scopes and the light overhead. We have to protect that existing composite there so it doesn't start to stiffen or crystallize. But here, the chemistry is actually helping that and giving us materials, whether it be a bonding agent. Some of these nano-influenced bonding agents have a bracket life, as if you kind of made that up there, but the ability to stay in ambient light for 5 to 6 minutes, where we remember a lot of times the earlier bonding systems would actually start to cure rather quickly. And curing is another factor that we have to take into consideration, where we're dealing with some of these lighter shades or even the darker shades, and reducing the curing time for some of these composites. And, this technology is getting involved with, bulk fills. And, I mentioned a bulk fill and a doctor would say, oh, I've tried them before. And she would say, they never really worked for me. And it's because of the older chemistries that don't help in regards to the characteristics that we want from that bonding system or from that composite. And again, for what all purposes, I wanted to kind of open a conversation up about, how these technologies are influencing these materials. I do a lot of hygiene lectures, and as a dentist, I'm always interengaging with my colleagues, but I saw where the technology starts right from the beginning, and it's the preventative aspect, where talking to a dental professional that's dealing with desensitizing or sensitivity issues brought on by medications or illness, a variety of things that can affect the mouth. I ask them, what are you relying on to address the situation? And many of them would say gluma, glutathione. Yeah, it's great, but we have to be careful with many of the desensitizers that we've currently had seen on the market. And it's these nanomaterials that are they're influencing how even insurance companies are paying for certain procedures. They're changing the wording on, it's not a desensitizing, it's a nano-filled desensitizer. And that's a game changer when you think about it, because whether it's something that your patients are buying over the counter, or this product by Voco, there's another product out there. This Remin Pro is very similar to Zen CP, and what makes the three products that I've mentioned different than the previous materials is they're using a nanohydroxyapatite within the matrix of this material. So they're just not sticking to the surface. They're actually penetrating and going deeper than previous products out there. And to understand why a nanohydroxyapatite in that cream, that calcium and the phosphate, why would that be a solution? Well, we deal with this every day. Our patients come in, they have dry mouth. We need to create an environment that's stimulating saliva production. Antihistamines, antidepressants, antispasmodics, anything anti has an association with mouth dryness. And our patients are trying everything possible to increase saliva, hardtack candy, constantly sipping on soda or water or a favorite beverage. We can rely on a tooth cream. Increasing the fluoride, again, the combatingness of the caries that they deal with every time. And then the neutralizing of these acids in the mouth. And all three of them are great solutions that come from utilizing a tooth cream, especially a tooth cream that has a nanotechnology or a nanohydroxyapatite evolved with it. I always use this slide, whether it is dental clinicians, hygienists, front desk people. There's top 12 of why our patients should be utilizing a tooth cream. And it's nanohydroxyapatite. It is that combination. Is it going to help stop the demineralization of the tooth and help stimulate remineralization? All of this is seen with, the 12 reasons why, you can actually suggest a tooth cream to our patients. And it is very beneficial if it has an advanced chemistry in it. But I always put that up there just to remind the audience that, if you're not incorporating that with ortho or, full roundhouses in treatment, it should be there because it can actually help the patient. So why the nanohydroxy? There is that association. The word of the night, one of them is the nanohydroxyapatite, the ability to help promote recrystallization around these white spot lesions. And the one study that I did have up there, it concluded that the size of the hydroxyapatite, the nanoparticulate, had the potential to start to recrystallize or form a barrier around these demineralization areas and actually help promote a stronger tooth structure. So something to take into consideration. What's its impact on bonding agent, right? I can mention bonding agent to a clinician and they would say, listen, I've been using the same bonding agents for I don't know how long. I know how to work with it. I know how to deal with the situations that may arise with it. I may have to use an activator. I may have to use maybe an additional step. But we have to take a look at why is nanoparticulate really a game changer in regards to the bonding agent. And we have to look at the matrix. What is involved here? We're looking at the collagen fibrils. We're looking at the dental tubules, the adhesive resin itself. Or I should say, we have to be aware of what a nanoparticulate in this matrix can do. And a lot of times that nanoparticulate actually reinforces the hybrid layer for a very long-lasting bond strength. It does have the ability to, optimize the wetting of that exposed collagen fibers and even the micro retention etching pattern on that enamel itself. Why would you want to do that? Because it actually increases the strength of that bond. And that's where, again, you may be using a 2-bottle system. You may have to use an additional activator. The nanoparticulate in this matrix is really changing the way that we look at how we use bonding agents in our practice. And why the benefit? Well, you look at the nanoparticulate, the silicone oxide. Apologize, there was an error there. It's not dioxide, it's silicon oxide. But we want to be able to look at the spherical fillers. And that's going to help in regards to reinforcing of the tags. Think of it this way. If we're using a macro or a micro material, they're odd shaped. They may be triangles, they may be rectangles in particle size. But as I stated earlier regarding the definition, they're all spherical. And that ability to have more contact with the adjacent particle, and also in regards to reinforcing those tags. You're looking at increasing the strength and retention of these materials. A product I had on the screen, Futurebond U, the universal bonding agent by Voco. It ensures they come up with a catchy definition here, I should say, example. It's stick immediately effective. And that guarantees that the bond won't blow out or be dried out of the cavity when you have to air dry it. Increasing the retention, increasing the strength, everything that we're looking at, bond strengths between enamel and dentin. We're getting over 30 megapascals, 30, 36, depending on the substrate that is in contact with this material. And again, we're all looking for the holy grail of making sure our restorations stay in the mouth. And there's that optimized wetting of the adhesive, the ability to, I use the analogy all the time, I can grab a box of rocks and throw them on a table. And, many of those rocks are going to roll out, land where they want because of their shape and size. If you take those box of rocks and make them into spherical marbles, take the box of marbles and roll that across the table, or even if you look at it on the occlusal surface or on a cavity prep, the ability for this material to flow over and optimize the wetting of these adhesives. Actually, something that we want to deal with. And then lastly, this has always been somewhat of a side thorn with dentists, dealing with post-op sensitivity. And if you're able to minimize that post-op sensitivity, or even eliminate it, we look at what type of chemistries we've seen in the past. And many times the micro and the macros had much higher post-op sensitivity issues, where nanoparticulate, again, with all the preceding characteristics that I mentioned, helps in reducing or eliminating that post-op sensitivity. Okay, so dental professionals, we're always looking to streamline product use. And interesting enough, when you start talking about the chemistry of these materials, it gives us the ability to use them in a variety of different ways. And it allows the clinician to take the self-etch or selective etch, even the total etch, and allowing them, there's no risk in contamination or destruction of that etching pattern. Interesting enough, many of the bonding agents have the ability to dissolve the smear layer with, certain hydrophilic or acidic components to it. Interesting enough, Voco has done very well with that with their Futura Bond U material. And this demineralizing of the tooth structure allows for a deeper filtration of the collagen fiber net. And it actually helps in regards to the retention of that in the dental tubules with the bonding agent. We see also the material being utilized in ways that we never thought we would be able to. An intraoral repair of a composite restoration. How about a ceramic veneer or an all ceramic restoration? Many times when you had to deal with chipped porcelain, we would have to inform the patient, we're probably going to have to redo this restoration because we can't do it within the mouth. Fortunately enough, we can with these new nanoparticulates in the bonding agents because they actually lock in and work well with existing porcelain and metal substrate without any additional primers. So again, something that we can say, wow, I can really utilize a product like this for some of these issues, these emergencies that come up within my dental practice. I mentioned glutathione, desensitizing. The ability of utilizing your bonding agent, not only for a composite restoration, but under even amalgam restoration, acts as a barrier for thermal protection for that tooth, giving you the option to utilize the bonding agent instead of a glutathione. Another factor, desensitizing cavities or core preparations prior to cementation on indirect restorations. Very low film thicknesses occur with using the nanoparticulate. Many of the one bottle system, one coat application, giving the end user a film thickness 13 microns and smaller for under that crown preparation. All characteristics that many of the restorations are looking for. Protective varnish for a glass ionomer. We're looking at our bonding agents as a workhorse for us. Instead of going out and getting a glaze or a specific agent for that material, we're utilizing that bonding agent that our hygienist can use, our expanded function, the dentist can use for a multiple of uses. So we talked about the preventative side. We've talked about the bonding. We're going to take a look at how nano and some of the other chemistry has been influencing our composites. And it starts with the influence of the composites by actually allowing higher loads of pressure being applied to that restoration. And when you're looking at a material that may be a macro or micro malocclusion, they really couldn't take a lot of those posterior occlusal forces. This nanoparticulate definitely is the game changer where you're able to apply higher loads to that tooth and that restoration. We've talked, or I've mentioned to the audience, the improved physical values that we're looking for, better aesthetics. We're looking for something that has longevity to the material. And then it comes down to the deeper depths of cure. Some of the combination of technology is allowing a cure depth 10 seconds, cure depth of 4, 5, 6 millimeters, where in the past, many clinicians would never go any any smaller than maybe two millimeter increments, because they know the way that the product was curing and reacting under a lot of those occlusal forces. So Nano actually combines with a very interesting technology, and it's an ORMOCER. I mentioned, hygiene, desensitizing, changing the way we look at why you would use a desensitizing agent. And it's the combination of Nano and ORMOCER. ORMOCER, from the Fraunheim Institute, where it was developed back probably 20 years ago, and now being used in a variety of different aspects. And you're probably saying, okay, what is an ORMOCER? And when we look at what an ORMOCER is, it's actually organically modified ceramic. Again, we're playing around with the chemistry here. Organically, we like that, right? Something more biocompatible. It's modified. Yes, it's being influenced by other technology, the nano. And what characteristic does it give you? It gives you a ceramic-like, a hard material that acts like a ceramic. So how is that profile able to do this? And we look at what the material is made of. It's organic and inorganic copolymers. And interesting enough, it's like the hands across America. We're all standing there, hands out, left and right, and we're holding on to each other's hands. Well, there's only two hands that we can grasp. When you start to look at this three-dimensional cross-linking of the matrix, it's the ability of the ORMOCERs to actually go from 2 hands to 100 hands or 100 bond sites, just from using some of the classic monomers that are found in today's composites. Now, that doesn't necessarily mean that they're using all of those monomers. They're actually eliminating a lot of the traditional monomers to give the clinician a restoration that is close to 100% biocompatible. And for that patient, I'm sorry if your name is Karen, you've gotten a real bad rap over the last 3 years, but for somebody who's complaining about what you're putting into your body and how it's reacting, we're able to manipulate the chemistry of certain composites and eliminate a lot of those traditional monomers, to the point that when a doctor or a hygienist, whether it's a composite or a sealant, and cures it, when it's polymerized, it's not going to give off any traditional residue or monomer. It becomes inert. And that is a real change that we see with these composites. And again, you're looking at an ORMOCER, whether it's preventative or restorative, where it's based on silicone oxide and completely free of a lot of those classic monomers that we've usually seen in some of our composites in the past. And it starts to make us question, can this really do us well when we're placing it in the mouth? And it's the last couple years, Voco, 3M, Dentsply have all been, trying to reinvent these chemistries or redevelop the emergence of these technologies, and taking the properties of a nanohybrid material. And we kind of mentioned this earlier, the reduction of the resin and the surface hardness of the material. And if you could combine it with an ORMOCER with a shrinkage value, and this is where doctors start to say, wow, how much shrinkage is involved with some of this new technology? We're getting close to 1%. where in the past we would see 3 and 4% shrinkage with much of the materials that we're using. Interesting enough, I'm proud because, with the ORMOCERs that help develop some of these newer composites, VOCO was one of the leaders in regards to bringing a higher level of biocompatibility to a family of dental restorative material. We're looking at no classic monomers that we've normally seen in the past. And in regards to that silicone oxide and that matrix of the resin and the glass particle and the inorganic and organic matrix of it, it's leaving us with a very high degree of cross-linkage. 0% residual monomers when you start to look at the measurements that we're seeing from some of the third parties that have looked at these composite resin. So with that said, we look at a different family of material. Now, interesting enough, this I would probably have to plug for VOCO because they are one of the only companies out there that have this type of composite in their product line. It has silicone oxide nanofillers in it. It has silicone oxide hybrid fillers in it. It even has a silicate base to the resin. And the benefit of that is actually giving a dental professional an all ceramic based direct restorative material. And when we start looking at the characteristics and take those high loads, improve the physical values of the material, and even go deeper in the cure, we're able to create a ceramic-like restoration. And interesting enough, that is their product, the Amira Fusion family, that is actually doing all of that. But what a lot of dental professionals like about this material is up to 50% less shrinkage and shrinkage stress compared to other composites out there. So when you're looking at a posterior composite and you're putting a composite in there and you're light curing it, you're worried about if I'm putting it at the right angles and the right increments because you don't want to put a lot of undue stress on the material. But as I used the analogy earlier, we saw not just 2 bond sites, but 100 bond sites, so that they're reducing that stress internally with the material and giving you a far superior restoration. So something to think about. Shifting, I got less than 10 minutes left, but we're looking at how this evolution is combining with some other technologies out there. TVT, just like the Nano, that is something that is a buzzword, thermal viscous technology. Why would this be somewhat of another game changer? A lot of these technologies are game changers. And I think, again, opening that conversation with my dental colleagues out there, how can you utilize this new technology? And it's interesting to see what it does and how it does. Meaning that, you're taking a material, and it seems to be a trend these days where many of the KOLs are talking about putting composites in a composite warmer or utilizing a gun that kind of changes the way the material reacts. And interesting enough, you're looking at something that's going from a solid to a liquid and then going back to a solid. So you're getting the, how can you say, the choice of 2 worlds, the ability of a material to react like a composite flowable, and yet a packable. Interesting enough, the chemistry, when it's heated in a composite warmer or a dispensing agent, it's at a certain temperature, higher, to change that packable into a flowable, to make it liquid. But when it enters into the tooth preparation, it starts to cool down to body temperature almost immediately. So you're able to immediately start sculpting this material as a packable. And it's really the ability to kind of get into those 90-degree, 80-degree, the boxes of our preparations to flow like a flowable. And you may say, well, hey, Dr. Bill, I use a flowable first, and then I put a packable on top of it. But wouldn't it be nice to kind of streamline that and just use one material? And that's what we're seeing with this new material. As I said, it rapidly cools to body temperature when it starts to enter into that preparation. But interesting enough, we see with the higher fill rates of this material, 83%, it has great strength, very low shrinkage. We're looking at shrinkage, as I said, 1.25 to 1.5, and even a lower wear rate. So that this material, if it's placed in an area of malocclusion or there's a lot of forces that we're dealing with, the material can really hold up. And you're not going to see that in wear faceting on the tooth itself. So what are we going to do with all these technologies? I mean, we talked about the nanos, we talked about the ORMOCERs, we've talked about the thermal viscous technology. 3 cutting-edge technologies. How can a dentist, how can a hygienist utilize this in their everyday practice? And we start to look at where these materials can actually be applied. Any type of restoration we're looking at bases in class 1, class 2 cavities, reconstruction of damaged anterior teeth, faceting of discoloration of the anteriors, improve aesthetic appearance. You can actually use it as a splinting material for perio. I have a couple of colleagues from dental school who are periodontists, and they're looking for a composite that can actually withstand a lot of the pressures that the patient or that maxillary mandibular is putting on those teeth. And it's found in some of this new technology. I mentioned earlier, the repairing of the veneers, defects. Pitt and Fisher, desensitizing for my hygiene and my preventative followers out there. Deciduous pedo patients, core buildup material. I mean, you can see that you can actually utilize many of these technologies that I've mentioned this evening in almost all of the procedures that you're doing in your offices. So again, it's that ability to open up the dialogue with your colleagues, with your office, streamlining. Are we running into issues with, delaminations or debonding of restorations? The aesthetics, you praise yourself as an aesthetic dentist, and you want to be able to use a material that gives you the end result. And many of these technologies can do that. So with that said, wrapping it up with 10 minutes to spare for Q&A, we look at what we talked about this evening: Nano, ORMOCER, thermal viscous technologies. They are real. We are going to see more of them. As I mentioned, the ability of nanotechnology to improve a composite by reducing the shrinkage and increasing the strength of a restoration, how those nanoparticulates actually influence the composite, the ability of higher loads, improved physical values, even giving us a deeper cure. Now, I'm not going to dismiss my preventative side, because we saw where ORMOCERs can actually be used as a desensitizer and as a composite. Bonding agents, I know, again, you open up that can of worms with changing your bonding, but a bonding agent that gives you great bond strength, increase the strength and retention of this material, and to say the least, eliminate or minimize post-op sensitivity issues. All of these technologies can actually help in regards to that. I want you to open the dialogue with the person who's selling you these materials, the Patterson rep, the Henry Schein rep, or even colleagues in office. And what are the clinical benefits that these materials can actually offer you and your patients? And I think many of that would be the high points that I put together. And listen, again, it's streamlining our use of materials, productivity, reducing the multiple use of products, and the efficiency that we have with our dental materials that we're using. So I'm going to go into the Q&A. There is my QR code for anybody. Again, I had the privilege of talking for 50 minutes on this. We can probably talk for 5 hours on some of the subdivisions of the characteristics and of subdivisions within the products themselves, from bulk fill to flowable and all of that. But reach out. I would be happy to answer your questions or put you in contact with somebody that can give you any of that. So open, is there any questions in here? Let's see. I do not see. Nobody wants to ask a question? Huh. Okay. Well, with that said, ladies and gentlemen, again, there's my QR code. Reach out to me via text or email, and I'd be happy to share some more thoughts on tonight's subject. So I thank you all. Be safe out there. Enjoy the rest of the summer. August is upon us and winter's right around the corner. So take care, everybody. Thank you very much for your time.